Hi, I'm Dr. Rashmi Yogish, Clinical Director and Consultant, Khushi Fertility and IVF Center, JP Nagar, Bangalore. Heavy bleeding during periods should never be ignored. This could be either because of a problem in the uterus or it could be due to a problem in the hormones secreted by the ovary. Most of the times it is due to presence of fibroids or tumors in the uterus that result in heavy bleeding during periods, especially if these fibroids are in the muscle or if these fibroids are projecting into the cavity of the uterus. It results in heavy bleeding during periods, which could also be quite painful. However, sometimes due to hormonal issues that prop up from the ovaries, there could be heavy bleeding during periods, and this should be a cause of concern. Anybody who has heavy bleeding during periods should not just take some hemostatic tablets to reduce the bleeding or just pop in some progesterone tablets and try to hold them back. Should definitely consider doing an ultrasound examination, especially a transvaginal scan, to be sure and to be able to understand what is the true and the root cause for this heavy bleeding during periods. Sometimes the heavy bleeding during periods in women who have irregular cycles and polycystic ovaries could be due to excessive estrogen in women with PCO who don't ovulate regularly, and this excessive estrogen can build up the endometrial thickness so high that there could be heavy bleeding during periods that goes on for days. That's the reason why women with polycystic ovaries, when they have irregular cycles and if the cycle flow is heavy and prolonged, should consider getting a vaginal scan done to understand what their endometrial thickness is. If at all, several cycles of such heavy bleeding goes unnoticed, then the proper endometrial thickness would not be there anymore, and the endometrial thickness could be very high. The blood layer inside the uterus, which is called endometrium, can get too thick, and this can result in a condition called endometrial hyperplasia. Why we are so worried about this element of endometrial hyperplasia is because if unattended to, endometrial hyperplasia over the years can slowly progress to complex changes in the lining of the uterus of the endometrium and could be a forerunner for endometrial cancer. That is the reason why women who have thick endometrium should seek medical attention and take proper treatment without ignoring the same.